Well, Governor Steve Bullock gave an update on COVID-19 cases within his office today.
He also introduced a couple from Butte who shared their experiences after contracting COVID-19. MTN's Jonathan Ambarian reports.
Governor Steve Bullock confirmed Thursday that a second staff member in his office had tested positive for COVID-19. He said it's a reminder that the virus can affect anyone. The governor's office announced the first positive case Wednesday. 4 other staffers were close contacts with one or both of those employees and are being quarantined. Bullock said he and Lieutenant Governor Mike Cooney were not close contacts and tested negative on Wednesday and Thursday.
And with masking up and following other precautions like sanitation and disinfection in the governor's office, it's our hope that this virus will be contained.
Bullock also introduced Gilbert Herrera and Gina Sandin, a married couple from Butte who both contracted COVID-19. Last month, they began experiencing severe symptoms.
I couldn't breathe. I felt like my chest was constricted, my breaths were shallow, and things were starting to go black.
I was dizzy, delirious. I couldn't stand without getting nauseous.
Both spent multiple days in the hospital and received antiviral treatments. Herrera said he was initially a skeptic about wearing masks and called COVID a shamdemic. Now he says his perspective has changed.
This virus does not care who you are. Doesn't care what color you are, doesn't care, if you're clean, dirty, or whatever. If you're gonna get sick, it's gonna get you. Now, I'm a firm believer in wearing the masks, because I just don't want to see anybody else go through what we had to deal with.
Bullock also provided an update on federal nursing teams who will come to Montana next week to assist rural hospitals that are facing staff shortages. 1 team will go to the High Line, while 2 will go to eastern Montana. 2 more teams will come to the state after the response to Hurricane Zeta. In Helena, Jonathan Ambarian, MTN News.
State leaders also said today that they are working on moving all local health departments' COVID-19 reports onto a new database. They say the change will streamline the process for the state to get updated numbers. The goal is to resolve some of the discrepancies that have appeared between active case numbers in state and local reports.